Hi everybody, I'm Dr. T and this is Dr. T's Corner. Alright, so today we have our second episode and we'll be talking about a very interesting topic. I like to call It Doesn't Bite. And really, these things don't bite. Okay, so what's the crux of the matter? So over the years as a medical doctor, I've had my patients, have some reservations about some very, very important matter. And I feel like I need to bring some perspective into it so that they get to understand it better. So I was thinking to two things. First, surgical intervention, and second, our admission. Okay? So let's get right into it. Surgical intervention. What does that mean? It basically means you have to get a surgery to get better. As simple as it comes. So patients have learned that they like to run away from these things because in their mind they concluded that when they hear surgery, it typifies death sentences. And that's not really true. I'm a Christian, right? And I hear many people say, Ọlọ́run á ṣe in Yoruba, and that means God will do it. And I don't disagree. I believe in the healing power of Christ. So yes, God will literally help you. God will literally heal you, right? But why do we just think that He cannot heal through us, the doctors? I mean, God helps out in every profession. So He helps us in our profession too, right? You can trust that God will heal you through the wisdom He has given us, to help you out. And I think that's something to be proud about. That's something worth being happy about, What am I trying to say? For a doctor to tell you that the only way you can get through this particular disease condition is by having a surgery. The thing is that when you take time to decide whether you want to have the surgery or not, it might sometimes mean that the disease condition might get worse and worse. Yeah, I did that on purpose. Worse and worse. And if that happens, it might make the condition a little bit more complicated. Like even if you now get to do a surgery, it might now be 50-50 or sometimes 90-10. And then the so-called surgery typifies death might not be the reality. What am I trying to say? If your doctor says you need surgery, then you need surgery. Yeah, pray about this and get healed before the surgery occurs. Fantastic. We are happy. You are happy. But if you don't, you can also get healed by God using us to help you by getting the surgery done and getting you all fixed and good to go. I'm just saying surgery doesn't mean stop and then, gotten better. I will not deny that some surgeries also at the end of the day might not be successful and some people die. But not only surgeries that kill people, I mean, some people can have accidents today and die. Some people might sleep and not wake up and die. Some people might use oral medication and die. So there are many things that kill people. So some surgeries, yeah, at the end of the day, might not be successful due to different factors. I'm just trying to let you know that when you hear that you have to do a surgery, it doesn't mean that, oh, this is a death sentence. I think that should be demystified, and I hope I have done that right now. Next thing are admissions. I hear many of my patients say, no, I don't want the admission. No, please, don't worry. We'll be coming to get the injection. We'll be coming to get the this. We'll be coming to get the that. Well, you need to get it straight. If we say that you need admission, then most likely it's because you need the admission. Why? It's not just about giving you medications to your brains as medication. It's also about monitoring you, checking your vitals from time to time, making sure that the treatment that we're giving you is actually working. We have to observe you, do daily checks. Sometimes some people have wounds, we have to do some daily dressings and observations, we have to take clinical pictures, we have to do rounds and discuss about the case and see how we can get you better. Okay? If you don't get admitted, and you have to have some clinical symptoms that show us that, okay, truly, you need this admission. And if we need to admit you, let's admit you and get you better. So the thing that happens is that many times when we say you need admission, and you now say, oh, no, doctor, I don't want, you go back home. And then, guess what? You come back, now requesting for this admission. And when you come back worse. And one thing is that we never coerce patients to doing what they don't want to do. It's a free life. You choose. So we lay on the table the options that are available for you, and you choose the one that you want. And if you choose not to be admitted, it cannot force you. It's your choice. But when you come back, you now come back being worse than you were previously, and then that's not too good. But still, we care about you. So yes, we get admitted that we start the medications and start become participate as soon as possible. What am I saying? You don't have to wait for it to get worse and worse. No. Listen to us. We want the best for you. Help us help you get better. Please like, share, and subscribe. And remember to stay healthy, true, and beautiful.